So right now, you often get paid. So contracts for brand name medications are usually based off of AWP, which is average wholesale price, which people can look up. There's a whole issue of people fixing that and not being an actual the average wholesale price. And so it's often AWP minus 15%, 17% that brand name will get reimbursed at. And then generics, which is the most popular by volume, they're reimbursed at what's called the MAC, which is the maximal allowable cost list, which is basically just a spreadsheet somewhere at a PBM, which is a pharmacy benefit manager that administers the pharmacy benefit on behalf of an insurer of a plan. And so what they do is they literally have this Excel sheet somewhere that determines each day, sometimes multiple times a day, what the price of a medication, of a generic medication is. And nobody gets to know that, so that's, there's even lawsuits right now trying to expose what is the MAC list, and sort of PBMs treat it as a trade secret, like a Coca-Cola recipe, so they can't share with anybody. This is the price of a medication. And so on top of that, so you would think, okay, when you reach the pharmacy and you show your insurance card and the pharmacy bills it, then at that point, what was that AWP discount price for a brand, or the MAC price for a generic. So you might think, okay, that's the price. And it is for the patient whose copay might be $2, or it might be a percentage of the total, like a 20% copay. But for the pharmacist, the story doesn't end there, because sure, they might get paid, let's call it on a $100 medication. The copay for a patient, let's say, is 20%. So the patient pays $20, and the insurance, again, said it's $100. So the pharmacy is now expecting $80 from the insurer. Let's say they bought that drug for, I don't know, $90. So there's the $10 profit. They're getting the $80 from the insurance maybe in 2 weeks. So I think, great, they made $10. But as you said, there's these clawbacks, these DIR fees we mentioned before, that are established fairly liberally by PBMs on how they want to track whether some metrics in aggregate or in one. But long story short is 3 months, 6 months down the line, the pharmacy might look at their bank account and see $20,000 leave their account. And they're wondering, like, what is that for? And it turns out that there was a fee for each of these prescriptions they filled over the last 6 months that now they're going to take back, let's say, out of that $80. The insurer, the PBM decided they're going to take back 50 of those. So now the pharmacy, instead of making $10, they're losing 40 on that prescription. And they didn't even know that they were going to lose it until 6 months later, right? So you're constantly living in this, in the dark. You're running this business as a pharmacy.
The money they already spent, right?
Exactly.